So, good afternoon, everyone. My name is Dr. Mininim Oseji, and I am the Medical Director of Berachah Community Clinic in Asaba, as well as the coordinator of the clinic's Senior Citizen Center. I want to thank you all for joining us this afternoon, wherever you're joining us from. And I also want to appreciate our guest speaker. It's just about 6 a.m. in California, but as the go-getter that she is, she has been able to rise early to do justice to our program. So I'm going to put up my video for now, and then we'll go ahead with the program.
Keep my own when I finish.
I have just put the program in the chat, and we will have a welcome address. Then we are going to have a presentation by our guest speaker, question and answers, and then everybody put on their videos for us to take a good photograph and have a record of today's event. So without much further ado, I am going to give my welcome address. It gives me great pleasure to welcome you to this webinar on setting your house in order, how to prepare for retirement and afterlife, being organized by Berachah Community Clinic Senior Citizen Center in Asaba, Delta State of Nigeria, in collaboration with Next Level Hospice Care in Habra, California, United States of America. Berachah Community Clinic Asaba was established in April 2014. In April 2014, to provide the following services: outpatient consultation, immunization, growth monitoring and nutrition services, breastfeeding support services, screening for cancer of the breast, cervix and prostate, HIV counseling and testing, reproductive health services, school health services, occupational health services, comprehensive health screening, which is medical checkup followed by a report, travel health services, treatment of infectious diseases, including STD, that are sexually transmitted diseases, health promotion, how to maintain good health, home-based care, medical outreach services, telemedicine services, rehabilitative health services, training in public health and community medicine, as well as research. A senior citizen center for persons who are 60 years and above was officially opened by Berachah Community Clinic on Saturday, 1st July 2023, with the hope of contributing to filling the gaps identified in providing health and other social services for our senior citizens in Asaba, the capital of Delta State of Nigeria. The center is specially prepared to provide relaxation, socialization, information, and care for senior citizens through well-being talks, games, arts and crafts, book reading, film viewing, periodic free medical care, and lots more. The time of operation is every Friday from 9 a.m. to 5 p.m. Registration for membership is free, and members are encouraged to come with another senior citizen to make their experience more interesting. Today's event was inspired by the realization of the gap in preparation for retirement and the afterlife, which has led to poverty, poor physical and mental health, as well as contention over property inheritance on the passing away of breadwinners. It is hoped that at the end of this webinar, participants will be equipped to face retirement and the afterlife with a greater sense of control and a joyful appreciation to God for a peaceful life well spent. Our guest speaker, Tess Reyes, is currently the Chief Executive Officer of Next Level Hospice Care and is well able to do justice to this topic that has sparked the interest of so many since the advertorial was released. On this note, I wish to thank you all for honoring our invitation and contributing to making this day a reality. Thank you and God bless. I am Dr. Mrs. Mininim Oseji, Medical Director, Berachah Community Clinic, and Coordinator, Berachah Community Clinic Senior Citizens Center. Thank you so much for your patience. And we will now call on Tess to upload her presentation and give us the presentation for which we are all gathered here today. For those who may be joining, I just wish to let you know who may be joining now that we are recording and we're going to be uploading our recording on YouTube so that even after now, you'll be able to watch it again and again and also share it with friends and family. Or if you want the presentation slide, I'm going to put my phone number in the chat. You just send me a message via WhatsApp and we'll forward the presentation slide to you. So let us welcome Tess Reyes to give us her much awaited presentation. Thank you, Tess.
Oh, thank you so much, Dr. Oseji. Thank you for your great introduction. Good afternoon, everyone. And my apologies earlier, video and audio was working on my Zoom. I was just mentioning to Dr. Oseji that I dropped my computer while I was traveling. So now I guess she would have to assist me to share my slide. But I'm honored to have the opportunity to discuss retirement planning with you today. With over 2 decades of experience in financial planning and serving retirees and their families, I've developed a deep understanding of the complexities and nuances of preparing for what we call after work life. I'm passionate about sharing my knowledge because I firmly believe that informed decisions pave the way for a secure and fulfilling retirement journey. Understanding the importance of retirement planning is where we will tackle for now. Many have asked me why retirement planning is essential. I'm sure we've asked ourselves that question. Perhaps you've pondered the same question. And one key reason is that retirement can span longer than anticipated. Like here in the United States, we have 10,000 senior citizens every day, becoming senior citizens every day. And the number one worry is, will they outlive their retirement savings? Especially with the increasing life expectancy. We can show slide number 1, please. With Nigerians living longer, as you can see, I hope we are sharing this slide
Michael,
where we
please,
have the
can
graph.
you share the slide? Michael, you're supposed to share the slide now.
I'm sorry for the inconvenience, but this just to show you what we have in 2010. Nigerian average life expectancy was about 50.8 years old. So I mean, you've got a lower life expectancy than the rest of the world. In 2020, it went up to 55.21. So 20 years from now, let's say about 2040, the average life expectancy will be higher, 63, right? But I understand that retirement age in Nigeria is 60. Am I correct, Dr. Oseji? Based on my research, that's kind of like what is the rule. At 60, they're expected to retire, especially in the government service. Okay, right. But from my own perspective, retirement is very subjective. We can retire anytime we want. It's a matter or a question of, are you ready? right? Some people can retire at age 30, at age 40, whenever you want. It's being prepared. So as we can see that life expectancy gets longer, it becomes even more critical to have a solid retirement plan in place to ensure a comfortable and worry-free retirement. There are three primary reasons why retirement planning matters. Number one, retirement marks a significant life milestone in our life. Number two, planning ahead provides financial security and peace of mind. And number three, without proper planning, there's a risk of outliving savings or encountering financial challenges in retirement. If we live longer and we run out of money, then there's a lot of things that we are facing, right? Like funding our healthcare, and funding our lifestyle. What we want to do is to be able to keep the lifestyle that we have in our while we're working, and have the same lifestyle when we retire, and preferably much better, because we already put in our time working hard during our younger days. So I think it's time for us to just be comfortable and enjoy life the way we want it. So let's go to slide number 2. The key areas of financial planning and retirement success. Number 1, are we on the slide number 2? Investment
Still
allocation.
working on it. I'm still working on it. Michael is not responding, so I'm trying to do that. Just give me a minute.
Oh, sure. Okay. But I can just go and maybe we'll catch up on that one. Those areas of financial planning and retirement success, of course, investment allocation is number 1. I'm sure we have a similar, probably, structure on investments as we have here, where you have, paper investments, information gathering to understand individual goals, values, and spending habits. We have to know ourselves better. We want to know what our goal is when we retire, which is very, very important. And the values, when we retire, we think of not just ourselves, but our children. And I understand, I came from the Philippines, and Filipinos are so closely knit family. And having been in Nigeria and seeing, I could say I have immersed myself in somewhat the culture, the Nigerian culture, and I'm continuing to do so. It's that you also have the same close-knit family, that we want to take care of everyone in our family. From the children, the grandchildren, we want to provide for all of them. So most of us are thinking of having a generational wealth that could be transferred from generations to generation. So investment allocation is very important, because we want to make sure it will last for a long time. Dr. Oseji, just let me know when the slide is.
I've tried to share it. It's supposed to have come on. I don't know what's holding it.
Yeah, technical. Yeah, I love technology, but sometimes this is what we get. But
So
that's
sorry
fine.
about that.
It's okay. Number 2, generating income is another area that we need to look into. Goal is to establish multiple streams of income and aim for living off interest as much as possible. The objective here is to really establish like different incomes or several incomes from different sources. If we can live off the interest of the principal that we have. A good example here is if someone has $1 million and you invest it in a very, I would say, conservative investment, like what we call a CD, certificate of deposit, that could, as of now, maybe could give you about 5%. Your 1 million could give you about $50,000 a year. Is that enough to live on? I'm sorry, I'm speaking in dollars because I know it's. I always get shocked when I speak of Naira, because it goes to millions and billions. So what we want to do is we want to make sure that we keep that principle intact, and we just spend the interest from it, so that later on it could be passed on and it could still keep growing, and we could depend on that, not just for ourselves, but for our maybe the grandchildren that we might have in the future, right? And without proper planning, it would, like I said, it kind of like would give us a lot of setbacks, which we don't want to happen. The next one is understanding the source of income is also crucial in determining tax implications. I'm talking about taxes because here taxes really impacts our income. And I'm sure as a, what we call this, developing country, you're heading towards the same trajectory. Tax planning is essential as it directly impacts the amount of income you get to keep. It involves strategic decision based on health, longevity, spending habits, and financial goals. Another one is healthcare planning, which I'm sure it's very close to your heart because most of you are in the healthcare industry. Often overlooked, healthcare planning is critical in retirement. It entails anticipating healthcare needs, including long-term care planning, and this is to avoid potential burdens. You know, one major medical issue or surgery here in the United States could wipe out someone's financial stability. I am not sure, but I'm not sure about the Nigerian situation. The cost of medical care. I have met a lot of Nigerian physicians here, and most of them come to the US, well, because we have a different setup. But this could be an issue to some of the retirees that are in the country in Nigeria right now. And this is something I still have to kind of make more research on what the situation is over in your country. The next one is, of course, estate planning. This step involves optimizing finances, structuring assets, implementing charitable and gifting strategies for those who have like overflowing, you know, financial gifts. It goes beyond wills and trusts, aiming to ensure assets are distributed according to your wishes and your objectives. It's very important that while you are still alert, while we can still make decisions, we want to make sure that those wishes and goals that we have could be implemented even we are gone, or even we become, you know, sometimes I'm sure you know about Alzheimer, dementia. When we get to that stage, who's going to decide for us? There are decisions that are made by other people that we do not want. But if you want to have your decisions implemented, even though you're no longer in your sane mental situation, you can have those trusts and wills in place. And that's part of estate planning. And then the last one, which is I think is also very, very important, is having that palliative and hospice care planning. Because in retirement planning, this aspect is just as important because we want to make sure we keep our dignity even up to the last stage of our life. And by doing that, we plan ahead. And that's part of retirement planning. The reason why the first three items are in that sequence, investment allocation, generating income, and reducing taxes, is because without investments, there's no income. Without income, there'll be no taxes. Then we don't have that much problem, right? To think about. But we have more problems to plan to. Even though these items are in this order, in reality, they all need to be addressed at the same time. We need to look at all the three things in different scenarios and looking at how much income you can generate because you want to live off the interest income as much as possible. But we also need to look at the tax impact because our focus is not how much income do you generate, but how much income you keep. And this is applicable in anything. we could be making a lot of money right now, but is there something we can show for it? Because some people will just splurge and forget about spending, forget preparing about the future. So on the investment allocation, which is it's just like an image on our slide number 3. The first item requires allocating your investments and managing risk. Risk typically comes from either external factors such as the economy. In your case, the fluctuation of naira, the value of your money is really, I know, impacts a lot when it comes to investments, also savings. You want to purchase a vacation home or you want to make a monetary gift to your grandchildren. There's an instance where I'm not sure, but I just want to mention there's a foundation that I am helping in Delta State, and I just saw how the exchange rate has affected the movement or the mobility or the capability of what we can do. Like if we give in, let's say $1,000, when I was there, it's like the exchange rate was, I think, 1,600 or 1,500 to a dollar. By the time I left, it's 1,100. So, when we were planning, we're going to get this, we're looking at the different value, and all of a sudden, like, oops, we cannot do as much. So that happens, and that would impact too your retirement. So think about ingredients in a recipe, such as having too much sugar or too much salt. But in this context, we're not just talking about a bad meal because you can redo that the next day. We're talking about retirement, and with the wrong ingredient or allocation, you run the risk of running out of money and going back to work. Now, we see that happening here in the United States. Or you might not have enough to pay for healthcare expenses for yourself or for your spouse. And you might not be able to meet the needs of your, the grandchildren who you want to provide for too. The first step, is a very critical step in the process. And there are different accounts that you could put your money into when you want to address certain types of risks, such as economic downturn, so that you're not just holding all of it in cash, or it's not all allocated to one account like your pension. This is like saying, do not put all your eggs in one basket. I'm still not very familiar of the different programs or pension plans or investment plans that are available for people in Nigeria. Because here we have different types of annuities. I'm sure you have all the stocks. People put money in Bitcoins, and those are high
Yes,
risk.
check properly. That title fish couldn't have finished. Have you checked that fish?
Okay.
Please, can we all mute?
And the rule of thumb on this is in retirement, we have a rule of thumb. The older you get, the more percentage you put in to a moderate or conservative type of investments. A good example is if you are already 60 years old, 60% of your assets should be allocated in a moderate or conservative type of investments. 40%, you can still afford to put it on those aggressive ones like stocks, Bitcoins. But the older you get, as you get to 70, then you put more on those conservative type of investment. And the reason why is you already have shorter period to catch up if the downturn happens in your investment. There's a saying, the longer our best asset really is our youth and health, right? The younger we are and the healthier we are, so we can expect more in the future if we prepared properly in the early days. And retirement planning, you don't plan the day before you retire. It's a long-term plan. I was just telling Dr. Oseji, people should start planning their retirement on the very first day they go into the workforce. because the end goal is always like, what happens after this? I want to make sure I'll work hard now and have a comfortable life when I retire. So our next one is generating income, which is our slide number 4. And creating multiple income streams that you have, like I said, you have the paper assets, which we call the stocks, bonds, certificate of deposits, real assets, which are real estate. I always consider real estate investment as one of the best. It's a long-term investment, and I'm sure you are all very familiar with this. Our best investments always real estate, your home. I'm sure most of you own your own home, and a good example is something you buy today for maybe 100,000. In real estate here, the average for the past 50 years, average growth of real estate investment is, it must have gone higher. It used to be 7.85% a year, but that's a 50-year average. So no matter what you say, the home is included in your retirement. That's part of one of your resource to get income from for your retirement. It's the home, because what happens usually, which happens here, you get to downsize. Maybe now you have like a 10-bedroom home, which, because you have a big family, but by the time you retire, you end up like empty nesters, right? Your children have their own homes and they have their own families. So it must be just you and your spouse. So you don't need to maintain a big house. And so what you do is you downsize and get a smaller one, and whatever profit you made becomes part of your retirement savings. And some would invest in real estate by buying apartment complex, and that gives them a continuous stream of income. And, like I said, that's one of the best, because rent goes up. And if your home is already, or that the apartment complex is fully paid, you don't have to worry about anything or paying any mortgage, except setting aside money for maintenance. But the rest is all yours. So the next one is tax planning. Tax planning, it's big here, and I'm sure you're going probably through that same trajectory. Like I said, we wouldn't want to get into a car during a thunderstorm. This is how I do it, without putting on a seatbelt, not turning on your headlights, and not running the windshield wipers, and just drive. We need visibility, good decisions, and be able to react when needed. When planning for retirement, we need to know how decisions today will impact our financial security in the future. 2 things I want to address are the difference between tax advice and tax planning. Tax advice is what we go to our accountants to help us figure out deductions, strategies, how to report our taxes so we can pay the right tax and not overpay. So the bills that we pay could be tax deductible. And that's part of going to that's what we call tax advice. Tax planning, however, is usually done with a financial planner. Just like me, this requires looking at things such as your health, spending habits, goals, so that they can be incorporated into an entire financial retirement plan. Tax advice is for the past, right? Tax planning is for the future. And believe you me, I have encountered a lot of clients that would always tell me, you know what, I'm not ready for retirement. I don't have this, I don't have that. And it is because they have not put all their documents, they have not really inventoried what they have. Because some people, especially doctors here, and I'm sure there too, they're so busy with their career, with their profession, and they would just like invest here, invest there, not knowing like, oops, they have invested so much, but in their mind, they have not invested enough, and will always worry about, I'm not ready for retirement. And after sitting down, doing an inventory of what they have, seeing what their goals are, And they're all surprised to find out, like, oh, I have that much and I can use this, I can use that. They're able to identify the possible resources of where their retirement income would come from. And it will amaze you. I mean, you can do this by yourself. And when you get home and do an inventory of what you have, and to kind of like just an analysis, a simple analysis of how much will I need for retirement. If I invest this, what I have, and this is the income, will that be enough? So that's one thing that you can do. So another one is healthcare planning, because like I said, here, one major health issue that would require major surgery, and I don't know, maybe especially doctors are aware of this. Here in the US, it could wipe out your wealth. Especially if you don't have an insurance coverage. I know you do have one there. There's an health insurance program that you have, but I don't know that how intensive or extensive the coverage is. Because here we have what we call co-payment. If I'm not insured and I just go for, let's say, a simple colonoscopy, I could be hit with a like $15,000 bill. Or if my insurance is not that good, I could still have to pay like $5,000 for that simple procedure. So that's how healthcare planning is important too, as part of your retirement planning. It becomes a long term. Like I said, people live longer than before because of the modern, what we have now, modern medical technology. I'm sure you've heard that there's a new cure for HIV, and there's also a possible cure for liver cancer. I just saw that in the news the other day, and I think there are 8 equipments in the world that's able to cure the tumor in the liver that could prevent spread of liver cancer, or which used to be, once you have that, liver cancer is really terminal. So those are the things that we have to look into. So people will probably live longer and longer and longer in the near future. And of course, estate planning is the most important, because this is when you are really, after the inventory of getting an inventory of what you have, you want to make sure you have everything written out, and you already have to start planning as what do you want to pass on to your next generation, to your family, to your loved one. You have to spell out everything, and that's when you need a state lawyer, or I don't know what you call it. You probably put it in a will, and also the trust. If you want, if a lot of excesses, you can put it in a trust fund for your grandchildren and great grandchildren, and also study the implication of taxation, because tax could eat up the earnings of that, money you're setting aside for the next generation. So these are the things that I'm giving this to you, thinking that we have a similar infrastructure when it comes to, financial structure here in the US and there in Nigeria. And I think most of you too has access to what we have here in the US. Because more and more, I'm understanding that more and more companies here, like insurance companies and investment companies, are really open to, and we have been open anyway, to foreign investments. And if you want stability, of course, they always they said dollars or, pounds would always be stable and strong, or the euro. So those are the things that we can discuss. Think about. While you're alive, all the assets you own are your estate, right? This includes your house, your car, furniture, retirement accounts. These are all what we call estate. The goal in estate planning is to get them out of your estate so that they will not be subject to income tax or estate tax if structured properly. You can even get an income back from those assets that can go back into your estate to fund your living expenses. Another aspect of estate planning, which is very close to my heart, is charitable giving. The most common error we've seen is when people die, they leave money in their will to a charity or church. However, in the same money, if the same money is given as a gift during your lifetime, they could have also gotten an income tax benefit. They could have given you an income tax benefit. Of course, we give to charity because we want to, but it behooves us to understand the tax code and how we can strategically give that money to pay less taxes on it. We have, I think I've met a lot of philanthropists too, Nigerian philanthropists along the way. And so I am addressing this because some of you are probably in that category. One thing about retirement, think of it this way. You might, $100 now will not be the same value of $100 5 years from now. That $100 might just be worth $50 5 years from now, or even just $10. Right. So if we're thinking of retirement, if I have now $1 million, it's enough. Maybe not. But on the same token, when you retire, you expect to spend less because now you are retired. You don't have those activities of like, I still have to send my children to school. I have to provide expenses for, like going out to dinners, entertaining people, so many things. Because when you retire, you're already like winding down. Children are already done with school. Grandchildren are probably almost done too. So you're just thinking about yourself and your partner or your spouse. So maybe your 100,000 income during your work days, you probably would just need 70% equivalent of that during retirement. But we also have to keep in mind the effect of inflation on that money. So I would say in the current situation of our economy, your 100,000 that you are making currently from your business, from your work, is what you will actually need to when you retire because of that inflation effect on the value of money. So after we retire and we've done everything, people are, I'm sure you've met some people that after retirement, they become confused if they have no plan, because then they lived a busy life and all of a sudden there's nothing for them to do. All of a sudden the world stops. It's like a wheel, and all of a sudden you just put a brake on your life. So it's nice to think of like, what are my goals? What are the hobbies what are the things that I really want to do? It's not just the financial aspect, but also your emotional, the mental, physical things that are supposed to be taken care of when we retire. You want to make sure you keep healthy, keep yourself healthy, physically fit, because there are so many things you wanted to do. I'm sure I have, most doctors here, they play golf almost every day. And of course, that involves a lot of walking, or some people would love to travel. And those are the things you need to plan. What are the things that you really want to do? Because if you don't, you just find out that yourself, especially doctors, I think you know this, depression will seep in. And then, it's hard to get out of it. I've seen some people on the day that I just have one client. This is really very tragic. She's supposed to retire this February. And she's been a nurse for 35 years at Kaiser. And unfortunately, the husband had a heart attack last year. And we thought the husband is the one who's going to go first. But lo and behold, in New Year, this year, 2023 New Year's Eve, she experienced so much pain and they took her to the hospital. And, she's a cancer survivor. But medical people are usually non-compliant and are number one in self-denial that they are sick. It has, it came back and it metastasized, and that pain that she was probably ignoring, it's because cancer already is, spread all over her bones, and she passed away in 2 days. And retirement that she was planning. I just started talking to her like a year ago and helping her plan, but then it didn't go well because of that. So, and nothing was really in place at the time of her death. And this is just one, I mean, I would say she's still young. She's only 62. And it's something. So let's think of things that for the sake of our spouse, the children that we love, the grandchildren that we have, we want to make sure that we don't give them the burden of making the decisions for us. Because most of the time, and I see this a lot of times, if you don't prepare for these things on, if your retirement planning, asset allocation, asset planning, and healthcare planning, long-term care planning, it divides your family. It causes a lot of animosity. It causes a lot of fights, bickering, because they don't know. Someone would say, hey, especially medical directives. If you don't have a medical directive and something happens to you, who's going to decide for you? It's better that you tell them, hey, if this happens to me, I don't want to be resuscitated. It's what we call DNR, do not resuscitate, or hey, I want just this, I'm sure you have those kind of forms where people have to sign, and it will, so that you don't have to put the burden on your family or your loved ones to make the decision for you. And usually families would have different type of decisions to make for you. Some will be, okay, we just let them go. We don't want him to suffer. The other one, no, I want to keep him alive for as long as we can. And which one do you want? It's better that you make that decision yourself while you're still alive. Correct? And then the long-term care. It could be, I'm sure in Nigeria, you have a lot of people that could take care of you in a lot much cheaper price. Unlike here with our, caregiving is very expensive. But usually families could assist because your family love you. So what we have here is, I don't know if your government has, but I've read that in some states, I think this is, they advocate palliative on hospice care. What's the difference about palliative? Palliative care is, let's say you were diagnosed with cancer and you still want to continue treatment, but at the same time, you want to already prepare for the end of life stage. But the key is you want to continue treatment. Then that's what we call palliative care. This could be, here we have that the government basically sponsored Medicare could cover it for us. But I don't know what you have in place right now. I know some states started advocating this. And once you decide that, you know what, I am terminally ill, maybe less than 6 months to live, you don't want any more treatment, that's when you go to hospice care, and which is what I have. I have a couple of hospice agencies, because hospice care provides you or the patient comfort care. They don't want to be treated anymore. We just manage the pain and we made sure they go with dignity. And this is not only for the patient themselves, but also for the family. Because then hospice care here would provide visits from nurses, visit from what we call home health aid to help the family in bathing and, grooming the patient, cleansing and everything. And then we have what we call respite care, because some of you or your family member would be tired of 24/7 caregiving, just watching you. So they will have a volunteer or what we call home health aid that could be there for different hours of day, 4 hours every, and it's a total of 1 week. And then we provide the chaplain or, the priest, the deacon, or what you call pastor. And we also have social worker to make sure that everything is provided to the patient and the family. meaning everything. Are you able to avail of what the government is supposed to provide you? So that's a social worker's job. There might be some abuse going on, some people, because they have been taking care of their loved ones, and it gets to our skin sometimes, and they start yelling, and here you cannot have abuse, elderly abuse, or and that's the job of the social worker, and you could be reported. So those are the things that are provided in hospice care. It is free. Basically, in this country, it is free. And that's something I was just discussing this with Dr. Oseji, and maybe that's one thing good, especially for doctors like you, that you understand what families or patients go through during the end stage of life. That's something that everyone has to prepare, and maybe you can now prepare that too. And like I said, it's retirement planning, financial planning, long-term care planning, and that will basically capped by the hospice care that will be provided to you by either your family, and hopefully your government will have that in place, since you also already have those what we call health insurance that's being provided to the population. And we just have to educate them on the advantages of what hospice care can do. So with this, in conclusion, I'm hoping that what we say, we cannot change the outcome, right, of what we do, but we can affect the journey. We already are in our retirement thing, so but at least we can affect the journey, meaning if we prepared, then we would have a smooth sailing journey towards a better future, until we go to the other side. And I hope I have imparted something that you'd be able to think about. And if there are questions, I'll be happy to answer if I can, the best of my ability. And thank you so much for sharing your time with me today.
Thank you
Thank
so
you.
much, Tess.
Mhm.
It,
Oh, you're
it's
very much welcome.
it's
Yeah.
it's so packed that we're going to need time to go over it again and again to digest all the
You know,
information that you have
believe
given.
me. Mm-hmm.
Yes, so thank God, like I said earlier, we're going to put it on YouTube so that and share the link. If you
Mm-hmm.
want the presentation, you send, oh dear, I haven't sent you my number. I was supposed to have sent that earlier than now. So I'm sending you I'm posting the message with my number, so you could always ask for um the slides. Just send me a WhatsApp message and I'll just forward the slides to you so that you can go over and over again. So I just want to make a few comments on some of the things you talked about. Your
Mm-hmm.
visits to Nigeria, Tess, are more or less
Yes.
recent. And when I saw your presentation, I was amazed that you have data about retirement that even I, that live and work in Nigeria, I don't have. So I'm sure with time, you will get to really understand the way things have been working. And the
Mm-hmm.
issue of inflation, inflation is really a big thing. And this is something I've discussed with a lot of friends and colleagues. And I tell them that if you want to consider inflation, one thing you could do is use the cost of Coca-Cola. We all drink Coke.
Mm-hmm.
What was the price of Coke when you started work? And how many times your salary was the price of Coke then?
Mm-hmm.
So then how many times was how many times the salary is the price of Coke now? And then use that to calculate how much income at retirement
Mm-hmm.
you will have or you will need to be comfortable. And I'll give you an example. In 1992, when my salary was 1,000 naira per month, which was 10,000 times 10 kobo, and the price of Coke was 10 kobo in
Oh,
1992.
wow.
I know that because that was when I got married, and that was how much we had to pay for the bottles of Coke
For a
we
bottle of
shared
Coke.
for our wedding.
Mhm,
Then in 2018, my salary increased to about 13,000 naira, the price of Coke. So if you look at in 1992, it was 10,000. In 2018, it
mhm,
was 13,000. So it's 10 and 13,000. The difference is not so much. So you can increase it or whatever. So you use that as a way of gauging inflation. So the next thing you also look at is what is your expenditure? I give you an
mhm,
example of my expenditure. First, I normally remove 10%, which I pay as tithe in my church. A lot of people in Nigeria do that. Then
mhm,
I have staff that I pay, my personal assistants, my driver, and so on. Even though my driver is working for government, but I give him an extra allowance, housekeeper, and so
mhm,
on. Then I have investments. I have some business ventures. I have a private clinic and so on and all that. So from time to
mhm,
time, I'm investing in that and so on. Then I have children that I support. Then I have to do my healthcare, my health check, even though I'm insured, there are a number of things that are not covered by the health insurance in Delta State. So I still have to pay. I have to maintain my cars and so on. I have to buy food and I have to give
mhm,
gifts. This month alone, I know how much I've given for condolence and
mhm,
contributions and things like that. That is something that we do in Nigeria. I have to buy
mhm,
clothing. I have to save. And then I have to go on vacation. Vacation is something that I have been doing for like 20 years. I look at how much
mhm,
I was earning as a medical doctor, and I say, if I cannot use 1 month's salary and go and just have wind down, just be in a different environment, do some fun things, then what am I really working for? Because at the end of the day, I'm going to leave a lot of it behind. So
Correct.
that is something that we need to articulate. And many times we have not articulated that. The second
Mhm,
thing now is the financial planning for health. I have shared this with some of my medical women as well as my FGG Sewere
mhm,
class 82. When I said, as national president of the Medical Women's Association, I said that from the age of 30, you start saving like 50,000 a month, 500,000 a year, so that at the
mhm,
age of 31, you have 0.5 million, 45 million, 50, 10 million, 60,
mhm,
15 million, 70, 20 million. And that is, you keep that money for health emergencies.
mhm,
Because I told them that during my tenure, I was not going to do financial contribution for health emergencies. We're all doctors and we all know how costly health emergencies can be. And we know that
mhm,
the insurance right now is so rudimentary. It's not like in many of the developed countries. And so you will find out that you cannot meet most of the health emergencies, a lot of it, the health emergencies, just basic care. So you need to keep that and save. And a lot of medical women did that. And when
mhm,
I discovered that I needed I had a health emergency, I didn't have to wait for anybody to go and say, oh, I need this and that. I just took from what I had. And that was what I used to attend to my own health emergency. So what we're saying is that it's all about planning. But the truth
mhm,
is that we don't talk about it often enough. And that is why some people don't even know where to start from in the planning. And that is why we're so happy that you, Tess, you have been here. You've shared us in a very professional, you've shared with us in a very professional way how we should look at our assets, how we should look at our finances, the importance we should give to health, and then finally, the issue of end of life. End of life care is so important. I didn't know anything. I have been a medical doctor since 1989. That's over 30
Oh,
years. But it was
mhm,
not until I went and did a master's in the University of Sheffield, master's in public health, health services research, and I had to do my dissertation, and my dissertation was based on a placement in a law firm. And their interest was on this issue of people with vegetative states, minimal conscious states, and persistent
mhm,
vegetative states, and so on. And so as I was doing the research, my research was now on medical legal issues on of incapacitated patients. And that was when I discovered for the first time end of life care. I discovered
yes.
about advanced wills, Those were things that I had never heard of. So how can I how can I give a notice of do not resuscitate to anybody when I don't even know that such a program or such a concept exists? You cannot plan for what you don't know. So the whole idea now is that this event that we have had and this presentation we've listened to, it should stimulate the discussion so that people have discussions in their different meetings. They call experts from home and abroad to talk, and you begin to plan so that in the next 1 year from today's event, you have a definitive plan that you share with your family and everybody is carried along. And if for any reason health issues come or end of life come, whatever the matter, or retirement comes, it is faced with confidence and you have control and you don't feel helpless and you don't lapse into depression just because you didn't even know how to plan. So with that summary and addition, we will take questions. Thank you very much for those who have made your comments. We appreciate all your comments. Are there any questions? All right. A lot of people don't usually ask questions at times like this.
Yes, you can email me.
But you have, when you get the presentation, you will get Tess's contact on the presentation. And then you will also, from my own phone number, you can get more resources and all that. Like some of you were not there when I gave my welcome address. We found out that there was such a big gap in the issue of caring for senior citizens. And that was why we established the Berachah Community Clinic Senior Citizen Center. We wanted to fill the gaps identified in providing health and other social services for our senior citizens in Asaba, capital of Delta State. And the center is specially prepared to provide relaxation, socialization, information, and care for senior citizens through well-being talks, games, arts and crafts, book reading, film viewing, periodic free medical care. So we have an opportunity to interact. We've had games competition, we've had different programs, health talks, and just today we had a quiz, an online quiz on Easter, and we got 3 prize winners. That interaction, it will prevent any of our members from lapsing into depression because they know that they have people that are looking out for them, engaging them and keeping them occupied mentally and physically. So we need more of that. And so if you need to know more about the center, you can always send me a message. If you want to set up something similar in your neighborhood, we are very, very available to work with you and partner with you.
Dr. Oseji, if I may speak for, so your the center that you have, is that similar to what an adult care center? Therein the senior citizen would go and find something to do to stimulate their minds, keep them,
Exactly. The issue is that the cost of maintaining the place is the challenge. So we have the challenge of human resource. We had somebody that was there all through the week, and later on the person was doing it just a couple of days a week, and the person still could not meet up. So we had to replace the person. So that has been a challenge, but it's usually open on Fridays. Hopefully, when we get more resources, we're able to engage more hands. We can make it open 2 or 3 times so they can actually come play games and things like that. So you can actually bring somebody early around 9 o'clock in the morning and then go and do your stuff and so on. And then 4 o'clock, you come and pick them up. So it's like a child daycare center, but this is for senior citizens. So Nena is raising her hand. Nena, can you unmute and speak?
Yes, I can.
Okay. Nana, we're waiting for you. Unmute and speak, please.
Can you hear me?
Yes, we can hear you now. Yes, go ahead.
Okay. Good afternoon, everyone, and thank you for the beautiful, lecture. It was time well spent. Like I had written earlier, an insurance broker, and I understand so much about, you know, insurance and all that. But my question is this. I had already written the question. Anyway, if you worked for a multinational corporation, for instance, Total, Mobile, they have robust plans for their staff. And as long as you live as a staff and your spouse, you're entitled to medical until afterlife. So if you're in category, do you still have to, save money or put money aside for medical emergencies since you already have a corporation that is taking care of it? I just want to know. Then secondly, we know where we are coming from. The inflation in this environment can be very unpredictable. So money saved after a period of time could yield little or nothing at the end of the day. Is there any way to secure this money when you put it aside? Thank you.
All right, those are very good questions. On a multinational corporation that provides a very good healthcare insurance or benefit to employees, that's very, very good. However, the caveat for that, which is also happening here, and it could happen anywhere in the world, no matter how big the corporations, benefits could change. And I know you will tell me, oh, but we will be grandfathered by the benefit that we have. If they change it in the future, we will not be affected. A company that probably, you might have heard, Enron, which is a very big company here, went belly up. Nobody would ever thought that such a big company would go belly up. So what happens? Everybody lost their pension, everybody lost their benefit, right? Kaiser Permanente is a very, very good company. It's a hospital. It's in the healthcare industry. What they've been doing now is they're reducing the benefits, decreasing the benefits that's being given to employees. I myself used to be an employee of a big University of Southern California, where they said during my time, if you serve on so much number of years, 15 and up, your health insurance will be covered for life. Lo and behold, what happened? They changed it because now they cannot afford to finance it. So things could happen. So, and it's always best, if you're asking me, should I provide for that? Well, the best thing always is to have a backup plan. And if you have a savings intended for that purpose and you didn't use it, it's always nice. It comes as a bonus, right? That, oh, I have this extra because I am covered by this company. I don't have to spend it for medical, purposes. Then you can use it for some other things that could enhance your life. So that's one thing. And your other question is about, is that investment? Kind of like I lost that there was a second question.
Inflation.
It's
Inflation.
about
What can you do? The
Yeah.
second question is about inflation. What can you do?
Yes.
Oh, inflation. Okay. Well, in Nigeria, it's tough. Like I said, I experienced it firsthand, right? On how your money fluctuate. But then you could invest in something that's more stable, or there's really nothing much as stable as. But if you're investing in different currencies, but if you're in business, it could keep up with the inflation by just increasing prices too, right? But if you have just like stationary funds, then you just make sure your allocation is diversified. And once people
I
you
was
could
going
be
to
on
ask you
aggressive.
that
Yeah.
the multiple streams of income that people talk about, some of them could actually include things that earn you foreign exchange. For instance, while you're working in Nigeria, if you're very good in writing and you can get your books accepted and put on Amazon, you get a domiciliary account. And even if the book is, your ebook is the cost of the ebook is as low as $5, by the time 10 people buy your $5 ebook, you get $50, and then you multiply it with whatever exchange rate. Then you have other things like YouTube content. A lot of people, there's this guy, Tayo Aina, who goes around traveling and makes YouTube videos and so on. There's another one, I think, Undukwe, that is doing the same thing. And these are foreign companies, and they pay for the number of followers you have. And that means you can do all these type of things that are ICT related right there in Nigeria. And you can, and there is no, will I call it restriction, economic restriction, even things like making posters and so on. So like now we have Old Girls Association of Federal Government Girls College Owerri, and then people are doing something in Ireland or in Canada, and you have the skill to design posters and do typesetting and so on. They can hire you and you can charge honorarium. I remember when I had to ask one of my old girls to come and talk to my staff. She gave me her rates in pounds, and I had to convert it and send the money to her. So there are all these things that you can do to generate revenue. And if that revenue you're generating is in dollars, then it boosts whatever you are making in Naira, which for those of us who are salaried is fixed. Whether the dollar is going up or not, your salary is the same unless they choose to increase salary. The only thing you can do if you don't have any other stream of income is you reduce your expenditure. I do not know if that helps. Thank you. Ngozi, were we helpful in our comments to your response?
Yes, it was very good. I've already put it in the chat.
All right.
It's encouraging.
Yes, I promised Tess that we're not going to spend more than 1 hour.
If you're about to retire,
and we've done over 1 hour because it's been very interesting and a lot of people joined late. But I'm sure we can continue the conversation. This should just be the beginning of so many. If you've never attended a retirement program, you've never listened to a presentation, find out where they are doing things like this, engage, get information, plan. It should not take you by surprise. We are too educated, we are too mature for things like this to take us by surprise. And of course, once you get the presentation, Tess number is there for more personal engagement and advice. So we're going to take our photographs. Please, everybody, put on your best smile. Put on your videos. And I'm going to stop the sharing so that the videos can show. Okay, great. So can we all have our videos on? Yeah, I'm going to take some. Wow, beautiful ladies. I can see my madam at the top, Dr. Gonle. Dr. Lee, nice to see you. Dr. Bali, our M1 sponsor. My sister, Eunice, don't want to show us your face. We are looking at your DP. All right. Thank you all for joining. It's been so rewarding having you all. And we hope that sometime again we will be together to have another wonderful time like this. Thank you all, and bye for now. Tess, we'll continue.
Thank you so much. Yes,
now.
Thank you very much. You guys have a great afternoon. Bye-bye.
Okay, and thanks to my staff, Michael and Antonia. Thank you so much. Take care. Bye-bye.
You too,